As a nurse educator, you made some interesting observations about the impact of technology on clinical training. Tell us about that.
Well, I've been a nurse for 35 years, and there have been a lot of changes and advancements in technology which make things more efficient and much more quick to get done for testing and diagnostics. But there's a gap now between the technology and testing and how people are cared for or communicated with.
I understand clinical simulations with mannequins and robots are used in place of real hospital training. Does that work?
Oh yes, it works, it's great, but it's not enough. Clinical simulation has recommended for up to 50% of clinical training now for your future doctors, nurses, radiology techs, paramedics, and that means they can work on a mannequin or a computer screen rather than on a person. And there's a number of reasons for that. There's not enough people to train them in the hospitals. There's not enough slots for people to go to. People are higher acuity in the hospitals, so they're in and out faster and go to a rehab hospital rather than staying in longer where you have the continuity and more patients to have practice with. So now what we're seeing is the more practice on fake things, the less normal interaction with people is occurring. So in different scenarios when students are being tested, they're fine with the skills checks, but their communication of what's happening and that compassion with the communication is lacking.
What long-term impact do you hope to have on clinical training?
Well, we developed ReaLifeSim to really fill that gap. We created a device because there was no device like it that we thought we needed. And so by making a device that's affordable and wearable, students can practice on each other and know to practice their hands-on skills as well as their communication skills. So for instance, when someone's trying to start an IV for the very first time, they may really be focusing on the skills and not focusing on what they're saying, and they may sound very robotic and very non-compassionate. But by the time they practice for the third or fourth time and they've heard themselves, they're like, oh, I can't believe I sounded like that. You know, when they can hear themselves, then they feel more in the role of the nurse or the doctor or the paramedic because they see themselves and hear themselves doing it that way. So it improves competency on both of those levels. I think that, back to the question, as far as advancing clinical education, by keeping something affordable that offers a lot of opportunities to practice, we can reach people who don't have the budgets for the high-end, high-fidelity, really awesome simulation products, but it's much better than sticking a needle into a block. So you really get the feel by working with other people and the clinical skills training.